Do you know the delicate balance between ethics and client trust? In Zambia, ethical practice is vital in substance use services. Social workers and healthcare providers face complex dilemmas daily. Today, we will explore ethics, confidentiality, mandatory reporting, and human rights frameworks. Ethics in practice means upholding dignity, respect, and non-discrimination. This is crucial when working with vulnerable individuals. Practitioners must navigate conflicts between client autonomy and protection. Informed consent and culturally sensitive practice are key elements. Zambian communities are often tight-knit. Here, disclosure of substance use can lead to severe consequences. Ethical practice necessitates sensitivity to local norms. Practitioners must carefully consider the risks of disclosure. They must also ensure appropriate safeguarding for those at immediate risk. Confidentiality builds trust in therapeutic relationships. It encourages individuals to seek help without fear. However, exceptions exist, such as imminent risk of harm. Practitioners in Zambia face unique challenges to maintain confidentiality. Stigma and communal expectations complicate this critical aspect. Maintaining privacy in resource-limited facilities can be difficult. Practitioners should explain limits of confidentiality clearly. Documenting consent and disclosure helps manage client information better. Mandatory reporting can create tension with client confidentiality. Legal obligations require reporting critical issues like child abuse. Practitioners must understand Zambia's statutory reporting requirements. They should communicate transparently about disclosure circumstances. The solution lies in culturally sensitive communication. Engage clients in safety planning while discussing the consequences of reporting. Human rights frameworks emphasize the right to health and dignity. These principles expand access to healthcare and reduce discrimination. International guidance frames harm reduction as a public health matter. For Zambia, human rights principles must guide substance use policy. These policies should ensure access to prevention and treatment services. They should also protect marginalized groups, including women and youth. Zambia needs to rebalance its approach to drug offenses. Focus more on health and social interventions instead of punitive measures. This doesn't exclude action against trafficking but emphasizes treatment for personal use offenses. Investing in community-based treatment is crucial. Expand pharmacological and psychosocial interventions tailored to local needs. Engage community health workers and collaborate with NGOs for extended service delivery. Enhancing diversion and judicial alternatives can improve outcomes. Train police and judiciary for better referral paths. Conduct monitoring to evaluate impacts on recidivism and health outcomes. Systematic re-entry planning connects prisons with community services. Encourage employer engagement and reduce barriers to hiring individuals with past convictions. Policy reform should include professional guidance on ethics and confidentiality. Training for social workers and healthcare providers is essential. Embed human rights-oriented practices in current legislation. Zambia must balance international obligations with national priorities. Respectful engagement can strengthen domestic responses. As we conclude, remember that policy choices on substance use affect public health and human rights. A balanced approach protects communities while prioritizing health-centered responses for individuals. Check the link in the description for more information on this topic.